if you're gearing up for your NHA or CPT phlebotomy exams, then this explainer is exactly what you need. We're going to break down all those critical details that show up on the tests. You know, the little things that really separate a good draw from a truly great one. Let's dive right in.
So let's kick things off with a tool you'll be using constantly, the winged infusion set, or as we all call it, the butterfly. It's fantastic for precision, but it comes with one major risk. A single, tiny mistake with this tool can completely throw off critical test results and mean a painful redraw for your patient. Any idea what that mistake is?
First things first, why do we even use the butterfly set? It's definitely not for every single draw. Think of it as a specialty tool, one that's engineered for those really tough situations, like the small, delicate veins on the back of the hand, or for your pediatric and elderly patients. Now, the butterfly has two huge advantages over a standard straight needle. First, its needle is shorter, which lets you go in at a much shallower angle, perfect for those veins that are right under the skin. And second, that flexible tubing, it acts like a shock absorber, smoothing out any little movements and giving you amazing control. You've got a few options for needle size, usually a 21 or 23 gauge. A 25 gauge is really only for the absolute tiniest of veins. But, and this is a huge point for your exam, if you have to use a 25 gauge, it must be a thin wall needle. A standard 25 gauge puts way too much stress on the red blood cells, causing them to burst. That's hemolysis, and that will wreck your sample.
Okay, let's circle back to that number one risk I mentioned. The solution is a really simple but totally non-negotiable step. You have to use a discard tube. Let's get into exactly why this is so incredibly important.
It's kind of ironic, right? The butterfly's greatest strength, that awesome flexible tubing, is also the source of its biggest problem. That tubing, which can be a whole foot long, is full of air. So when you pop on your first tube, its vacuum has to suck all of that air out before it can even start pulling blood.
And just so we're clear, this isn't just some friendly advice, it's a hard and fast rule. For your NHA exam and out in the real world, failing to clear that air before you draw a light blue top tube is considered a critical error. It leads to bad results and, you guessed it, a mandatory redraw for the patient.
So, how do you avoid this? With this super simple 4-step protocol. You stick the patient, then attach a discard tube. A plain red top or another light blue one works fine. Let it fill just enough to pull the air out of the line, then pop it off and immediately attach the actual light blue top you need for the test. That tube will now get a perfect full draw. Simple as that. So here's the bottom line. The air in the tubing makes that first tube underfill. If that first tube happens to be the light blue top, your blood-to-additive ratio is going to be all wrong and the coagulation test is useless. The discard tube's only job is to get that air out first. That's it.
This table right here is study gold. Let me make it crystal clear. If you are using a butterfly and a light blue top tube is the first or only tube in your draw, you must use a discard tube first. No exceptions. This is a classic exam question, so you've got to commit this one to memory.
Okay, so we've protected the sample's integrity. Awesome. Now let's talk about protecting you. Needle safety isn't just some optional extra. It is a fundamental requirement of your job.
This right here is a black and white policy from OSHA. Every single needle you use, whether it's a butterfly or a straight needle, has to have a built-in safety feature. It's not something you add on later. It is a required, integral part of the device, period.
So, what makes a safety device a good safety device? Well, your exam is going to expect you to know these points. The safety feature has to be part of the device itself. It has to create a permanent barrier over that sharp point, and, this is crucial, you have to be able to activate it with just one hand, always keeping that hand behind the needle.
All right, we've covered the drawing technique and your personal safety. Now, let's dive into the science of what's actually happening inside those collection tubes. We're going to focus on the 4 major types of anticoagulants that you absolutely need to know for your exam.
First off, what even is an anticoagulant? Put simply, it's a chemical that stops blood from clotting. This is totally essential for any test that needs whole blood or plasma. And each anticoagulant works in a really specific way, which is why you can never ever just swap one tube color for another.
Our first anticoagulant is EDTA. You'll find it in the lavender and pink top tubes. EDTA is the absolute star of the hematology department. It works by grabbing onto or chelating calcium, which totally stops the clotting process. But its real magic is how well it preserves the shape and structure of blood cells, which makes it perfect for tests like a CBC.
The second that tube fills up, your job is not done.
you have to immediately invert it 8 to 10 times. And I mean a full 180-degree turn and back. This is not shaking. It's a gentle mixing motion to make sure that EDTA coats every single blood cell and stops any tiny little clots from forming.
Underfilling an EDTA tube? That is a huge mistake. The extra EDTA in a short draw actually pulls water out of the red blood cells, causing them to shrink. This gives you a falsely low red blood cell size on the CBC, which could lead a doctor to a completely wrong diagnosis. You always have to get a full draw.
Next up is sodium citrate, which you'll find in the light blue top tubes. Now, like EDTA, it binds calcium. But, and this is the key, it does it reversibly. That's because in the lab, they actually add calcium back into the sample to start the clotting process so they can time how long it takes. This is the whole basis for tests like the PT and APTT.
Now, pay attention to the difference here. A citrate tube only needs 3 to 4 times gentle inversions. So why so gentle? Well, if you mix it too hard, you can actually activate the platelets in the sample, which can mess with the clotting tests and give you inaccurate results.
This is the tube, where that blood-to-additive ratio is absolutely 100% non-negotiable. The tube is built for a precise 9 parts blood to 1 part additive mix. If that tube is less than 90% full, the lab will reject it on the spot. No questions asked. This is exactly why that discard tube with a butterfly is so vital.
What about when a doctor needs chemistry results, like yesterday? We call those stat tests, and that's where heparin comes to the rescue. Found in green top tubes, heparin works totally differently. It doesn't mess with calcium. Instead, it blocks thrombin, a key enzyme in the clotting process. This lets the lab spin the blood down right away and get plasma for testing without having to wait for a clot to form.
For heparin to do its job, it needs to be mixed immediately. As soon as that tube is full, give it 5 to 10 good inversions. Why the rush? Because heparin can prevent clots from forming, but it can't break down a clot that's already started. So immediate mixing is everything.
You also have to pay a really close attention to the type of heparin. Most green tops have lithium heparin. You would never, ever use that tube to check a patient's lithium level, right? It would give a crazy high result. Same thing goes for sodium heparin and sodium tests. You've always got to match the additive to the test being ordered.
And finally, we have the gray top tube. This one contains potassium oxalate and an antiglycolytic agent, usually sodium fluoride. The oxalate is the anticoagulant, but the real hero here is the antiglycolytic, which stops the blood cells from gobbling up all the glucose in the sample. This is essential for getting an accurate glucose reading, especially if that sample is going to be sitting around for a while before testing.
And just like the EDTA tube, the gray top needs a good 8 to 10 full inversions to make sure both the anticoagulant and the glucose preserver get properly mixed in with the sample.
And I know I sound like a broken record, but a full draw is critical here too. If you underfill a gray top, you get way too much oxalate for the amount of blood, and that can damage the red blood cells, causing hemolysis. The stuff that leaks out will then interfere with a bunch of the other chemistry tests.
This table right here pulls all of those key details on anticoagulants into one perfect little study guide. You've got the additive, the tube color, how many times to invert it, and the number one thing to watch out for with each one. Go ahead and pause here, take a screenshot, and make sure you have this down cold for your exam.
So, we have covered the equipment, we've covered safety, and we've covered the science inside the tubes. Now let's put it all together into a practical framework that you can use right there at the patient's chair to guarantee a perfect draw every single time.
Think of this as your 5-step checklist. First, know what the test needs: plasma, serum, or whole blood. Second, pick the tube with the right additive for the job. Third, match the tube size to the vein. A small, fragile vein just can't handle the powerful vacuum of a big tube. Fourth, get a full draw and mix it right away. And finally, give that sample a quick inspection for any problems before you label it and send it off to the lab.
And let's end on this one crucial point. You can memorize every tube color in the world, but it means absolutely nothing without proper technique. Getting a full draw, mixing it correctly, and handling it gently are just as important as picking the right tube. Mastering these details is what's going to make you an amazing phlebotomist and help you crush your certification exam.